Dr. Peter Jernigan, welcome.
Thank you, Jared. Thank you.
I know you pretty well. I got to know you at the coffee shop some. Don't know you super well, though, at least. So I'd like to start with kind of where you grew up and what growing up was like for you.
Yeah, so I grew up in Mobile.
I did not know that. I thought it was somewhere, some other state.
No. So I grew up in Mobile. I got two brothers, and we were born and raised there. My parents still live in Mobile, same house we grew up in.
Awesome.
And my older brother still lives in Mobile. Most of my dad's family is all in that area. So I was there up until high school. So I grew up, went to school, did not drink any coffee. My parents are not coffee people,
drinkers.
so we didn't drink any coffee. I hope they're not upset when they see it on a coffee podcast. No, we spent all my childhood there, and then I went to college at Alabama. So that was when I moved away from Mobile, and then kind of took a meandering path, slowly worked farther north for a while, and then we came back south for a while. And so, back to your original question, what was growing up like? So we used to joke, my brothers and I, that we had an abnormally normal family because my parents were really big on having, the family time, family unit. We had, family dinner pretty much every night. Unless, every once in a while somebody was gone to some kind of event or whatever, but pretty much every night it was sit down, have a meal together. We had a family devotion every night. And it was, all our friends were like, "You guys have dinner every night with your whole family?" We're like, "Yeah, you don't?" They were like, "No, we go wherever," I'm in the middle of my two brothers. My older brother, like I said, still lives in Mobile. He does a lot of interesting things. I would say primarily he's a musician.
That's my kind of guy.
Yeah. He kind of worked running a recording studio for a while down there in Mobile, and he plays music all around town. And then has all kind of interesting kind of side jobs that he does now. And then my younger brother went in the family business. So my parents are both accountants. They have their own little accounting firm. And then my younger brother did that. And I, for some reason, got interested in medicine. I can't really tell you like why or exactly when. I think sometime probably around middle school I started having interest in it and started telling my mom that I think I want to be a doctor. And she's like, "Okay, sure you don't want to be an accountant?" And I said, "No, I don't want to be an accountant. I think I want to be a doctor." And so one summer she said, "Okay, if you want to be a doctor, you should know what it's like to work in a hospital. So why don't you go volunteer at the hospital?" And she found at the Mobile Infirmary down there had a program for teen volunteers. And so I went and did that. Worked there for the summer, and it was not like full time or anything, but I still actually vividly remember the first day. You're wearing they still wore candy stripe, the red and white stripes, and I went down there and they said, "Okay, here's your introduction." You had to do some kind of a like an orientation, and they walked you around the hospital, and then they assigned me to a unit. And so I went to the unit, and the ladies there said, "Oh, welcome, come in. We're going to have you answer the phone." And I said, "Answer the phone?" Okay.
It's like a teenage kid's worst nightmare.
Yeah. I hated talking on the phone. And so they said, "We're going to have you answer the phone. If anyone calls, you pick up the phone, you push this button, and you have to tell them where you are, you have to tell them who you are, and ask them what you can do." So the unit was SPCU. I don't even know now. I don't even know what that stands for. Some sort of progressive care unit, I guess. They said, "SPCU, this is Peter. How can I help you?" I said, "Okay. What are you going to say?" "I'm going to say, SPCU, this is Peter. How can I help you?" Yes, that's what you're going to do. So they all kind of walked away, and I was sitting there at the desk like, "Man, I hope the phone doesn't ring," And sure enough, so I pick up the phone. I'm like, SPCU, this is Peter. How can I help you? And I hear him just start laughing. They walked around the corner and called me, and they're like, "You did great. You did great."
Oh, that's terrible.
And so I did all kind of, random stuff. I answered the phone. I would file charts because everything was paper charts back then. I would transport patients that when people got discharged or went to things. I would push the wheelchair and transport patients around. And it was cool. I liked it. I thought, I don't really want to answer the phone forever, but this is cool. I can work in this environment. And then I did some volunteer stuff when I was in high school. There was a doctor there in town who actually had been a general surgeon, and he did that it was like mid-career. He's a busy general surgeon in town, and he just felt like he was called to do primary care and take care of, basically underserved, uninsured people. And so
awesome.
he stopped practicing surgery, went and got credentialed. I honestly don't even remember at this point. At that time I was in high school, and so I didn't really think that much about it. I was like, oh, that's a big deal. He opened an office, volunteer kind of office. But now, having gone through residency and all the stuff that you do to be a surgeon, I think, man, that was like, that's a huge sacrifice of what you did. And then to say that not only are you going to give up that you trained to do, but you got to go learn a whole other specialty and get credentialed in a whole other specialty, because he went and got credentialed in family medicine. And then they opened a clinic there. And I know he was the physician, and I think they had maybe a nurse practitioner there. And they were starting to actually branch out, and they had a dentist who would come in a few days a week, and they had some physical therapists there. They had a pharmacist there who they would fill prescriptions for people in the house. They would get donated medications and things. It was a really cool organization that they had. And I'm blanking. I'd love to give them a shout out. No, I can't think off the top of my head the name of that. I want to say it was like Victory Health Partners, but in Mobile. So worked with those guys a little bit.
Still in high school at that time?
Yeah, I think that was all in high school. Kind of did some odds and ends stuff, but mostly just did high school, and kind of knew at that point I was pretty convinced that I wanted to do medicine, and so kind of trying to focus on everybody's like, oh, you gotta keep your grades up and everything. And in reality, if anyone out there is listening and thinks they might want to be a doctor, nobody looks at your high school diploma when you apply to medical school. As long as you have one, that's okay.
Yeah.
That's kind of early life up to college. And
so you knew from middle school age you had a desire to do medical school.
Yeah, there was a good friend. She was a teacher. She was a teacher at my school, and she taught biology and anatomy and physiology. She did a lot of the sciences, and she was a nurse. She had been a nurse before she went back and started teaching. And I had a really good relationship with her, both in class, like I enjoyed her classes, and then she was the student government sponsor, and so I got to know her really well. Her name was Phyllis Bryant, and she was a nurse previously, so she had some medical background, and her dad was a physician. I talked to her a lot about kind of medical things, and just career interests and things. And so I told her one time, I had thought about it. I said, well, maybe I'll do like nursing, because it's a shorter, it's like and she looked at me and she said, you won't be happy if you're a nurse. You need to be a doctor. And I didn't push her on that to say like, what do you mean? Like, what do you mean by that? Because I was thinking like, I think I could probably be happy doing that. Yeah. Seems like a great job and all. And now I think she's probably right, because I like being in charge too much. Yeah. I like, making the plan and kind of coming up with like, hey, I got to like figure out how to solve this problem, or put these things together, or figure out the problem solving aspect of it I like a lot. But so she kind of pushed me, study wise and school wise. But yeah, it was probably sometime around middle school.
It's really cool. You got a chance to try it out, kind of, or at least see if it would work. Because like medical field to me is one of those. There's very few things where you can either do it or you can't. Like a lot of people can't do medical. There's no way I could do medical or
Yeah.
firefighter or first responder, like
Yeah.
anything like that, because I can't handle that type of adrenaline rush, trauma,
Yeah.
stuff like that.
Yeah.
I just can't handle it. And I don't think many people can. I
Yeah.
think medical is one of the few things that like either you can do it or you can't. It's not for everybody.
Yeah, it was my early experience was pretty mundane, where there was not a lot of adrenaline involved. It
Yeah.
was a lot of office based, and in the hospital was kind of a unit that was not it was not a high acuity kind of unit. Not super sick patients. Nothing. There were no. It wasn't like Grey's Anatomy. People were not like busting the doors open and wheeling a stretcher through or anything. And really, I liked those settings that I saw. Kind of every aspect of it. I didn't have anyone in our family who was really medical. So it was all what you saw, where you went, and I didn't see any surgery. Really, I didn't know anything about surgery. And never really even considered it. I had worked with mostly all the doctors I worked with are kind of like family practice, primary care. And so I just always kind of pictured that. That was when I thought medicine, that was what I had in mind, was working in an office, taking care of people that way. I didn't really get exposed to surgery at all until medical school. I actually assumed, I had gone through all these rotations in medical school and thought that I was going to do family medicine. And I had surgery. It was the very last rotation of my third year of medical school. So you do medical school, you do 2 years of pretty much just classroom. You go through all the lectures, you do anatomy, and it's pretty much all. They have a few little exercises here and there where you go to the hospital and talk to a patient.
This is after you get your basics out of the way, right? You actually go to medical school.
Yeah, so we were talking about high school, and then I skipped college altogether. But you do, so you have to get some sort of a college degree, and you have to get all these prerequisite classes to go into to even apply to medical school. And then once you get into medical school, that's like 4 years, come out with your either an MD or there's another pathway where you get a DO. Both kind of converge as physicians. You can, basically go into any residency, any specialty either way. So, the first 2 years is usually, all classroom based. You're doing mostly sitting in lectures, taking notes, studying till late at night, wishing you didn't have to sit there reading so much. You go do other stuff. That was most of the first 2 years of medical school. And then third year of medical school is when you start doing your actual clinical rotations. And generally, at least I was at UAB for first 2 years, and then they had branch campuses. So I actually spent 2 years in Birmingham and then went to Tuscaloosa for the third year and did all my kind of core rotations there. So they have you go through basically every, there's a list of kind of what they consider core specialties. So there's internal medicine, OBGYN, general surgery, pediatrics, neurology, psychiatry. What else is on the list? I feel like there's something else on. They had us do a rural rotation with kind of like primary care in a rural setting. So I went through all of that and kind of liked everything, but didn't really know exactly what I wanted to do. And thought, well, I'll probably just do family practice. You could do a little bit of everything. They have some specialties you can do after that if you want to do something else. And I had surgery at the very end of third year. So I had already started like kind of making my list of places I was going to apply. And I did this surgery rotation, and I got about 2 weeks into it, and I thought, man, I really like this. This is really cool. The surgeon I was working with, he was a guy named Joe Wallace. awesome guy. He was a great surgeon, just a great person, And I remember sitting down with him and thinking like, this is somebody I like what this guy does, and I can see myself doing that. And I liked being, you're always moving. You're like in the operating room doing stuff, with your hands, and then you go around in the hospital, and then you go to the office, and you're always kind of moving.
Yeah.
And I like that. The office always felt a little claustrophobic to just sit and go from one room to another. And so I told him one day, I said, "Hey, Dr. Wallace, I really like this, doing surgery, but it's the end of third year. Like everybody is talking about, like, I've got my schedule set for next year. Is it too late to do surgery?" And he goes, "No, it's not too late." I was like, "Are you sure?" He's like, yeah, it's not too late. So I called, the schedule people, and I said, "Hey, I got to remake my schedule." Because he said the first thing you got to do if you want to do surgery is you need to go back to Birmingham, do your 4th year in Birmingham, and you need to see surgery residency. Because, there were no residents in Tuscaloosa. You just worked directly with the surgeon, kind of like what the students do here in Anniston. So he said, you got to go back there, see what it's like in the big, university, and you got to work with the chairman, because you got to get your chairman letters to get, recommendations for residency programs. So I, scrapped my whole schedule, redid my schedule, moved back to Birmingham, got an apartment there, and then got all those rotations lined up, and I said, yeah, I like this. I actually like it. So
It's wild.
yeah, that kind of from there, then you go into residency, and that's where you really like focus on doing surgery. You're learning how to actually do surgery. So
And you did that in Cincinnati?
yeah, that was in Cincinnati.
Okay.
Mm-hmm.
Cool.
Yeah, so University of Cincinnati.
So something that's really crazy to me, like I was riding one day with another doctor friend of mine. We're going to play Top Golf, and he was like, "How was your day?" And I was like, "Oh, it was rough. It was super stressful. We had somebody call in and was like making all these drinks, and it was a long day." And he's like, "Oh, okay." I was like, "How was your day?" He's like, "It's good." He said, "I did like 4 surgeries." And then he started talking about this one case. He's like, "Yeah, this is really bad. The lady's infected and it's not looking good, and she's young." And, and then it was just like silent for like 15 minutes, because what I'm over here griping about having a tough day making coffee. And then earlier I asked you, I was like, "Did you work any today?" And you're like, "Oh, a little bit. I did like 3 or 4 surgeries." And I was like, I can't comprehend that as work. Like, it's such a mind shift from what I do and have ever done, whether that's construction or working in a factory that I did for a little bit, making coffee.
Yeah.
Like, actually saving people's lives and making people better as a whole. To me, that's just mind-blowing.
It's funny because, like, I don't know, stress is stress. There's like the component of, like, if something goes bad, someone can die. That's definitely has like a high level of stress. But the reality is, for most of what we do, I mean, I guess if you're doing like heart transplants or something like that, where you're taking care of really, really sick people all the time, and you're doing big, huge, high risk operations every single time you do an operation. To me, I think, like, I'm kind of the same thing as you, but like looking at it from a different lens. I'm like, oh, I do general surgery. I'm like, most of what I do is, right now, a lot of what I'm doing is elective, and the patients are pretty healthy, and it's outpatient surgery and everything. It's like flying an airplane. You don't get on an airplane and think like, well, it might crash. I don't know, maybe some people do, but I don't think about it that way. I think like, oh, they do this all day. It's all safety checked. Everything is, it's been built to make it safe. And you do it every day, and you kind of get used to it. It becomes routine. You go in, and that's the office. You go in, the operating room is the office, and there are times where it's really high stress, where something is emergent or something is not going the way it should go in some way, and that can get really stressful really quickly. but also it's kind of like I feel like the operating room is my comfortable place because that's where I'm in control. I'm in charge there. And so I kind of know, like, I know the people on my team. I know what stuff we have available. I know what our resources and capacities are. And that's where I'm comfortable because I can control what I'm doing in surgery. I can't control when somebody goes home.
Mm-hmm.
What are they going to do after they go home? I don't know.
Yeah.
They could do whatever. They could do exactly what I recommend that they do, or they could go skydiving the next day. I don't. So in the operating room, there is control. And so that actually becomes most of the time like almost less stressful, unless you're doing something really weird or emergent but
Do you get a sense of, you said you like the problem solving aspect of it when you do have those cases that are, you got to figure out something, figure it out quick. Does that get you excited?
yeah, kind of, it comes in waves. I think all things in moderation,
Yeah.
There are times where it seems like everything that comes through the door is atypical and you're having to do some like different problem solving and like this doesn't make sense or this isn't the normal or some extra challenging aspect of it. And sometimes when it's nothing but that, I think like, man, I just really want somebody with a really routine, easy case to walk through the door next, But then if it's all kind of simple, straightforward, I get kind of restless, I think like, not restless, that's probably not the right word, but just thinking like, I enjoy going in and doing something that's very routine and like kind of the I don't know, like when everything goes exactly as it should and it's perfect, that's a very like satisfying feeling, to say like, oh, that went perfectly. That went very, very smoothly. But there's also, I enjoy the like challenge of figuring something out and doing something a little more technically challenging, whether it's a more technically challenging operation or whether it's a case that's kind of interesting. I don't know. My dad one time, he's not medical, but he used to say, you don't ever want to be an interesting case in medicine.
No.
Because, usually that interesting case implies that there's something not going according to plan, so that part is not enjoyable. But it is when you have something that's like, ooh, this is like a little different and you have to kind of put the puzzle together. It's nice to solve those. It's not nice when you have something that things aren't working or like the case is not going well, or you feel like you did the right operation and it went well and the person is still getting sicker. That's a really, stressful. It is that, but it's just, it's just that's very challenging. That's probably to me the hardest part of the job is you do all the things and the person still doesn't get better. You have that sometimes, and that's really hard.
How do you deal with that? Because we all have those situations in everyday life.
Yeah.
Usually not with somebody else, but man, it's just not working. I'm doing everything I'm supposed to be doing.
Yeah, some of it is, you talk to the patient, you talk to the family, you explain to them what you're doing and what's going on. For me, offline, in the immediacy of it, it's like you dig into the case, and like what's not here. You're checking what piece are we missing, what's not right. Thinking, going back over if you did an operation, what did we do? Like what could possibly not be going right? Especially things like intra-abdominal or internal operations. It's kind of hard because once you do it, then it's like a black box. You can do CT scans and X-rays, but to some degree you can't see without going back in, and that's a major thing to go back in and look. So you've got this kind of black box, and you're saying like, what could be gone wrong? Is there something that we did technically? Is there something that or didn't do technically, or is there something that we did right, but now it's not working. You put something together and it leaked, or so in the immediacy of things going wrong, it's kind of double down and say like, hey, what's going on? Do we need more scans? Do we need more labs? Do we need to go back to surgery? Afterwards, once you've kind of done all those things, you involve other people. You get consultants on board, or you ask your partners, hey, like, let me tell you about this case. I'm doing this, this, and this, and here's what happened. It's really nice. I've had, for most of the time that I've been out in practice, I've had senior partners, or at least other surgeons in the area who are senior to me, who've done it for a long time, and that's huge. I don't envy anyone who has to practice without that, because there's times where you just got to say like, hey, I've done all this, and I'm missing something, and to have somebody who's done it for 20 or 30 years say like, either yes, I check this, or no, I think that's all the things that I would do, and that's helpful. Afterwards, if you've done all these things and then you had a bad outcome, either somebody died or you had a bad complication of a surgery, that's harder to process, I think. And some of it is talking. I'll talk to my wife. It helps. She's medical. She's not a surgeon, but she is a surgical tech by training, and she worked in surgery, so she has some understanding of what happens in the operating room and what goes on. And so that's helpful to have that avenue to kind of talk through things. Talk to your colleagues that you work with, people that I've from training, friends along the way who have that kind of same mindset of surgery. Sometimes it's helpful actually to just talk to people outside of surgery. It's easy to get like, you're around, especially if you're around surgeons who do what you do. Almost always the conversation comes back to work. Sometimes you just have to like, sometimes you have to just like separate from it and say like, hey, we reviewed this case. We went through everything. I looked at all this. We have conferences where we go through and review things and cases. They'll have, some anonymous case that you said, present, here's what happened. And people all kind of say like, hey, what could we do better next time if we had this? But then once you kind of go through that and you say, hey, I've talked with the family or talked with the patient, and we've kind of let them know what's happening and kind of the full picture of here's what's going on and here's the ramifications of that. And we've reviewed the case and said, hey, I could have done this, or I couldn't have done, or I feel like I did everything right. And then, you kind of get through that, and then you kind of have to be able to let that go. Whatever. For me, I feel like that's it, is like reviewing this and just saying, technically, was there something I could have done or no? And then after that, kind of say, hey, I've done that. I've addressed that. I have to put that aside and let it go. Because you really do. You have to move on. You can't carry that with you into the next operation that you're doing. You can't carry that with you. To some degree, you can. You learn from it, and you grow from that and say, hey, I think back to residency when I was doing surgery training, and the most educational of all the, we would have lectures and conferences and things like that. And the most educational one for me was what they called M&M. It's morbidity and mortality. And so they would have once a week, every case, every complication, every death on any of the surgical services in the residency, you submitted. You wrote it up. Whoever the resident on the service would write that case up, and you would submit it to the residency director, and they would call on people to present those cases at the weekly meeting. And you would get up. It was actually a really intimidating space, because it was an old surgical amphitheater. There's only like 2 or 3 of them left in the country.
Where they observed?
Yeah, where they would bring people in and do surgery, and there's these like bleachers up in front of you where people would sit and watch. Yeah. And so you come into this room and it's really steep seating, because everybody wanted when they used to do that, you would want to look down onto the case. So it's really steep seats, and all the attendings, all the like bona fide surgeons are on this side of the room, and all the residents and students are on this side of the room. And the boss, the chairman, would sit right in front of you. There was a seat right in front of you that he would sit at. And you were standing there on this, it's like a tile floor. There's a drain in the middle of the floor. And you're at this little podium looking up at people like this and presenting. And you just start telling the story of, we had a 47-year-old woman who presented with these symptoms, and this stuff was done, and we made this diagnosis, and we did this operation on this date. And then you would have to present whatever went wrong. And then it was basically open forum for anybody who could say, why didn't you do that? Or did you think about this? And sometimes they would kind of ask you a few questions, and then the attending, usually if it got, started getting kind of ugly, the attending on the case would say, hey, this was my case. Let me, tell you what we had. But not always. Sometimes they just leave you dangling there, and they would sometimes just really kind of tee off on why did you do that? And then it was really, they could ask you anything they wanted. Didn't even have to be about the case. If some attending or if the boss decided he wanted to start grilling you about whatever his expertise was, he could just start asking you questions, and you'd be up there trying to answer them. And it was really not fun to be on like at this spot of that presentation, but it was really, really educational to be sitting up in the stands and just listen to a lot of these really senior surgeons talking about, hey, what could have gone wrong? What do you think happened? Or why do you think that happened? Saying like, hey, here's what I do on those cases, or here's how I set that up so it doesn't happen. Or sometimes they're just telling stories about, man, one time I had this case and we poured through it for weeks trying to figure out, and we finally came to this. And it was such a cool just gathering of people, like just airing all this expertise over problems. You think about like, oh man, this is like, you want to sweep that under the rug and not think about it again. But really, it's like, let's glean everything we can from a mistake and then move on. Then it's done. It's like they told me my kid came home from school the other day and had gotten in trouble for something. And they said, when my wife got there, she said they told her, don't bring it up. We addressed it. It's been addressed. It's done. You don't need, he doesn't need anything else. Move on from it. And that was kind of Eminem. It was really hard to get up there and do that, but it was really freeing to have released that, and say like, hey, we talked, we went through this, and maybe I got chastised for doing something or not doing something, but at the end of it, you say like, hey, I take from that everything that can be taken, and now I'll move on. And
you realize you're not the only one who's been through this.
You do, and you get all this experience. So that was a really cool, conference in training that I think about a lot. We don't have enough surgeons to really do that kind of conference, to have that big of a thing here, and everybody's, it's different when you're not in a training center. We still have a similar version of that, but it's not the same as being in a room with 30 or 40 senior surgeons, of all different specialties.
What does it feel like when you get it right? Like when somebody's had a problem they've been struggling with for years, or it's a young kid, and you just see their life change. Like that has to be. Yeah,
it's almost too good. It's like that's the drug. That's the it feels good. It really does. And I remember the guy I was telling you about, Wallace, Joe Wallace, the first surgeon I worked with in medical school, told me one time there was some case and somebody was talking, oh man, you did a great job on that, Dr. Wallace. And we got out in the hall and he said, I'm going to tell you what one of my mentors told me when I was in residency. He looked at me and he said, Joe, don't ever do this. Because when you do, that's when you get in trouble. When you stop looking at things very critically, and you think, oh man, I'm pretty good at this, like I fixed that person, but it does feel good when like when you have somebody who's been truly suffering and you do something and they get better. That was one of the things I really loved about surgery was, you go in and take something out and they feel better, or you put something together and they feel better. And it is a really rewarding experience. I wouldn't try to like minimize that because it is really truly rewarding to see how you can change people's lives. But it is also, I have to check myself and say like, hey, is this like, that's not my calling to celebrate, all the time and be like, oh, look at how good I did. It's very easy to slip down this like, oh man, I'm a great doctor. I'm a great surgeon. And for better and for worse, unfortunately, there are always the other side of that. And so, it's very easy to be humbled in surgery. You can feel like you did all the right things and everything, and still something goes wrong. And but it is really, really rewarding when you see people get better and they recover and they like come back to you in the office. They say like, that's my favorite part of clinic. I don't like being trapped in the office all day, but it is really nice to have people come back and they say, oh, thank you so much. I feel better. Like the pain that I had is gone, the lump is gone, the whatever is better and it's done. Or, some sort of a cancer and you get to bring them in and say, hey, your cancer is cured. It's gone. We took it out. That's a really rewarding part of it.
Yeah, it's gotta be. You get to use the technology a lot. You get to use the robots. I know you've told me a little bit about that. I found that's just super cool to me.
Yeah, that part is really fun. The toys, all the gadgets, of like different things. So my gadget primary one is the robotic platform. So I use that. I have a 1 day a week usually that I'm doing robotic cases, and so usually on Tuesday I'll schedule all my robotic stuff then.
How far have you seen the advances in that since you started?
They were doing robotics when I was in medical school, and it's a lot has changed. They've come out with a lot of things. It's kind of like your phone, like you're still talking on the phone with somebody, and and they've been doing that since I was a kid.
Still a phone.
But there's all kind of like cool features on it, and they've come out with a couple new. I haven't even used the latest. Like there's a new iteration of the robotic platform. But it's been cool to learn how to do it. It's been there, and that tool has been there in some capacity, but to kind of learn that and find ways to use it and integrate that into practice, that's been a lot of fun. I did some robotics in residency and the fellowship. So I did an additional year of training after my residency. So I was in Philadelphia for 1 year. And that was, they called it a minimally invasive fellowship. So we did a lot of stomach and esophagus surgery and then a mix of some other stuff as well. But it was primarily laparoscopic. So that's the kind of the precursor to robotics, where you little incisions, you put a camera in and you put air inside the abdomen, and then you work through these little, it's like the little grabber that you had when you were a kid with the alligator alligator mouth on the end of it. It's like doing that, but a little more sophisticated than an alligator mouth. But essentially the same thing, it's they've got all kind of different instruments that grab. They've got scissors. They've got things that can cauterize or shaped different ways to do different things. And you basically work through these little holes to do the operation. So then robotics is basically the next version of that. So you still do the same thing, but it's coupled to a robotic system that you drive. And so instead of having a straight stick, now you can move it, and it's got on the end of that stick there's a wrist, so you can move it whatever direction you want. And the camera has like, it's got two lenses within the camera, so when you look through the viewer it's like a 3D image. And they've basically built on that idea. They've made the platform smoother. They've made it where it has kind of more range of motion. And the newer versions, they're starting to actually integrate things like overlay a CT scan. And they're starting to talk about building in AI to say, like, you can upload 1 million CT scans and it'll like predict where the anatomy is going to be. Or you can upload this patient's CT scan and say, like, hey, it's not at the point where the thing is going to do an operation for you, but all kinds of tools to kind of guide what you're doing.
But the AI would be cool because I never thought about that. But everybody's anatomy is a little different,
Mm-hmm.
so AI can pull all that together and
Yeah,
give you a starting place at least.
yeah. Especially, I know some of the other specialties do things where you have some sort of a scan. You do like an MRI or a CT scan or an ultrasound that gives you an image, and then the machine basically takes that image and guides it to do whatever it's going to do. Some of these like orthopedic things where it's got like built into to whatever device you're using is a three-dimensional image of your joint or whatever. And I may say I don't know because I don't understand all that what they do with it and all that, but it's pretty cool, the stuff that's coming through. It's also kind of cool to see. I don't know, right now anyway, I'm sure this will change over the coming years, but right now in surgery, a lot of that has extended what you can do to some degree. It's made it where you can do the same thing through smaller incisions, but also a lot of what you're doing is still the same kind of stuff that people have been doing for 100 years, like the basics of kind of doing anatomic dissections and doing surgery, and a lot of the actual surgical techniques are the same that people have been doing. I mean, we suture almost the same as they would have done, like 100 years ago. And I think that's really cool. Some people maybe think like I'm kind of a Luddite. I'm not a big tech person in most realms. And so I like the idea that there is still very much a hands-on. There are a lot of things that you still can't do with a machine.
Yeah.
And I think that's really cool that you, even with diagnosis, I mean, there are things where going in and actually putting your hands on somebody, talking to them and hearing their story and hearing their symptoms and putting your hands on that person, you can make a diagnosis without a single machine, without a single, that aspect of it is one of the things I really love about medicine. There's a lot of the tech has kind of made medicine more, I don't know, what onerous. There's all this documentation and all this computer work that you have to do and all this charting work that you have to do that just grows and grows. And so the aspect of it where you actually come in and you connect with another person, like I'm a human being, you're a human being. I'm going to connect with you and try to help you solve this problem. That part I love. Like I love doing that.
That's the draw of the.
Yeah, I mean that was what I loved at the beginning. Like go way back to the beginning of when I got into medicine. That was the part that I liked. It wasn't really the gadgets or the tools or the the surgeries or any of that. It was the connecting with another person, finding out why they're sick, what's making them feel bad, figure out a way to help make that better. That was the part of medicine that I fell in love with,
That's so cool to me. I wish I could do it, but I can't.
Yeah.
Sounds really cool though. What do your kids think about it? My daughter she's fascinated with it. She watches, there's like a show called Operation Out. She loves that. It's like doctors in England, I think, and they show cases and how they figure it out for kids.
Yeah.
But then I took her, we were able to go to St. Michael's one day, and she talked with Miss Nanette. Miss Nanette was like, had to do a lot of schooling. She's like, nope, don't want to be a doctor. Which I'm sure that'll change, but she's interested. What do your kids think about it?
They don't probably know any different. They think it's cool. It's funny because at first my wife said, I don't want our kids to know that you're a doctor because I don't want them to be like doctors' kids. So she used to tell the kids that I worked at the hospital and I cleaned up messes. She was like, we're going to tell them that you're a custodian.
Yeah.
And I was like, yeah, I don't really want to lie to our kids, but we can tell them that I go to the hospital and I clean up messes.
That works.
That is true.
You clean up messes.
That is true. But pretty quickly they figure it out, And then there was a period of time where I was like showing John Larson these pictures. He'd want to see a picture of everything. Oh, what'd you do at work today? And so I made it like very like kid. I'd say, oh, I had to take out something called a gallbladder. What's a gallbladder? Oh, it's a little bag in your body that helps digest. Why did you take it out? Well, it was angry, and so we will like tell it like a little story. The gallbladder. My wife keeps telling me that I've got to write a kid's books about about organs.
Yes, you should do that.
But yeah, then he wanted to see pictures, so I would take. A lot of times we'll take pictures of like whatever, not a person having surgery, but of a gallbladder on the back table or a picture of the robot or a picture of whatever, and then you want to see pictures of everything. Can I see the angry colon, or can I see the angry gallbladder? And then they want to come. My daughter now wants to come to the hospital all the time. They like to come to the office and talk to all the people, but they do. My daughter now more than my son. She likes to play medical provider.
Cool.
So she'll get her little coat on and she's got her bag of supplies, but to her it just means she gives you a shot.
Yeah.
So if she ever wants to play that with you, if she says she wants to play doctor, don't buy it because she's just going to stab you with a pencil or something. Shot.
That's great.
So.
What do you? Is it pretty common nowadays that high school students can get a feel of it, like go volunteer at hospitals? Is that still?
It's changed some. I know, the stuff that I did when I was a volunteer, you can't do any of that anymore. It's like now if you want to transport, even from like the first year I did it to the next, they said, oh, you can't transport patients anymore. You have to have a special training thing, and you have to be, I guess I'm sure it's all like an insurance and liability thing. But you still, I think you can still do some sort of volunteering. I don't see it here. And I know a lot of things changed during COVID, during that whole period. Mm-hmm. They restricted a lot of who could be in the hospital. And some of it has come back. Some of it has not totally come back yet. I used to have high school students would come in and see things, and they've gotten now where like only here at the hospital they say only professional students. So, I can have like nursing students can come, medical students can come. There are some avenues now, I think, where you can bring college students who are pre-med or interested in medicine can come. But it's more restricted now than it used to be. Hopefully that opens back up again. Yeah. I still think though, if you're interested and you find somebody, I mean, everybody knows somebody who works in healthcare, like whether it's a nurse or even in administration or a doctor or a nurse practitioner or a PA or whatever it is, everybody knows somebody, and you can usually find some sort of avenue to get into that setting and ask questions and at least see, like surgery. Again, they're a little more restricted about who can come in for surgeries now, but you can usually still get into the medical setting and kind of see what's going on.
Yeah, I think that'd be really cool for
yeah.
people who are interested.
Yeah, particularly in offices. Like, usually in clinics or some sort of like doctor's office, you can usually have students. Like if I have high school students who are interested, I tell them you can come shadow us in the office, and that's usually okay. We let the patients know there's going to be a student here, and usually actually patients are usually for that kind of stuff are kind of excited. A lot of times I'll have the medical students with me, and they go in, and the patients are like really interested. They're asking the students all these questions, like, where are you in school? What are you doing? What are you going to be? And kind of get vested in the students as well as the students learning. So it's kind of a cool. That's an interesting thing to see of I think people have this interest in helping other people,
Absolutely.
and seeing that like, oh, even though I'm sick, I can be helping someone learn from this. That's a really neat thing to see that play out, and see patients who are sometimes like really sick or really uncomfortable will connect with these students and say like, yeah, hopefully you can learn something from this.
Oh,
And
that's really cool.
yeah.
You mentioned COVID. What was that hopefully once in a lifetime experience
Yeah,
like?
it was crazy.
We were able to take the coffee truck to a few different RMC, being one of them, at medical places during that time, and it was the first time we went to RMC. It was serious.
Yeah.
One person came out dressed up and set the coffee out. They got it, went back in.
Yeah.
like, um,
Yeah, now I feel like at this point everybody's kind of like, it's like the flu. But when it first started, it was scary. I was in fellowship, so we were in Philadelphia. I was at a huge hospital in downtown Philadelphia, and I was doing mostly elective surgery. I didn't really have much interaction with, the ICU, other than occasion we had certain patients that would go there routinely after surgery, and they'd usually spend 1 or 2 nights and then come out of the ICU. So I knew most of the people who worked there in the ICU, but I wasn't like actively taking care of critically ill patients. I was doing mostly elective surgery, and when it started, it was really, nobody knew what it was. That was the scariest part, is people were getting really, really sick really fast, and nobody understood it, even to the point of like, how are you exposed to it? Is it like airborne? Is it fluids? Is it, how is this spreading? How, who's susceptible? When I was in Philadelphia, what they did was, I was in fellowship, and then they also had the general surgery residents, and they split the whole, cadre of residents and fellows into two teams. They said, we want to limit how many people are in the hospital at any given time. So we would have a week where you were on, and then you would have a week where you were off, where the other team was on, which was kind of neat because my son was really little at the time, and so I would have a week off at a time. It was kind of crazy.
Great, yeah.
But then the weeks that you were there, I was doing, I got kind of shuttled off to do some other stuff, and then I was working and doing some moonlighting, and so they had all these patients in the ICU that were so sick, and just scary. Every day you're getting new like stuff about like protocols, and they were shutting down elective surgeries, and they were saying like, if you get it at all exposed, you got to quarantine for so long, and talking about all the people who are like dying after they come in with this, and it was really scary. I mean, I remember the first time I had to actually go into a room with a patient with COVID. I basically put on masks over masks until I couldn't breathe anymore, and I had they had the hood out there. I was like, I'll put a hood on too. Went in there like a spaceman, to just say like, hello, how are you? And they were, I'm doing okay. I was like, okay, good. And then went home and like took a shower as soon as I got home. And not to make light of the sickness of it, but it was, I like looking back, I probably looked fairly comical because I was so like suited up. And then when I got here, it kind of eased up, over 6 months or so. The first waves of it came and went. People
So
kind of figured out.
2020-ish?
Yeah, we moved here October 2020, or I started here in October 2020. And it was still really up and down. We had kind of at that point, I feel like people had figured out better how, early on it was like, at first everybody's doing that. What I did is basically like suit up everything, and then they were running out of stuff. You didn't have, you were like having all these shortages. They were rationing out masks. You basically wore the same mask all day. And then that kind of eased up, and then you got through the first wave, and then people kind of figured out sort of how to manage this and protocols, and then it was like these waves. The big problem after that became there were so many people getting admitted into the hospital in one of these waves that you couldn't do anything else in the hospital. The hospital was completely full.
Yeah.
And so then we would shut down surgeries. You couldn't do any elective surgeries. And we were getting just all kind of like consults for, lung problems, a lot of things things like putting in a what they call a chest tube to vent. If you have a collapsed lung, you have to put a tube in between the ribs, and it sucks out that air and basically reinflates the lung. And I put in more chest tubes during that COVID stuff than I did in all of residency doing trauma and everything else, because people just had sick lungs, and they were on ventilators for long periods of time. We were doing tracheostomies and all these things that we do, but never in that kind of volume. It was just the ICU was always full. The hospital was always full. And then you couldn't, patients with other problems, it was hard to get people through the hospital. And then a lot of the practices were struggling because, you kind of plan your budget based on doing a certain number of surgeries and a certain number of this, and then all of a sudden you can't do that for months at a time. It was really hard on a lot of people on a lot of levels. Not even, most of all, the illness. So many people sick and long-term effects of it, and people dying and family members dying. That part was horrible in and of itself. And then all kind of growing out from that, all these other things. It was really challenging. And I kind of came out of training in the middle of that. So I was actually talking with one of my partners the other day, and he said, I realized you don't know what it's like. You never actually practiced. Residency I did, but he said you were never in practice before all this happened. It's kind of changed. The whole face of healthcare is changing. A lot of people got out of medicine altogether at that point. A lot of people who were kind of considering retirement, but maybe not there, said, I'm going to just kind of hang it up and not deal with this anymore. And so then on top of everything else, now you have all these staffing shortages and then supply chain shortages, all these, the whole market. I'm sure running a retail. But the same idea. I'm sure you've seen it, like employment difficulties, supply chain difficulties, all that happens in the hospital too. And it's kind of changed, and everybody's really still figuring out how to do that, how to make it work. And there's other stuff too in healthcare. The whole industry is really kind of, it feels to me like a change in the process of it. It's like, I don't even know how to describe it, but something has passed, and it is yet to be seen what is going to come, and we're kind of in the middle of this. And you feel a lot of that difficulty from people. You hear it in people working at the hospital. You feel it from patients who are saying, like struggling to find kind of a medical home, hospitals changing. You hear that from patients of like things that, like I can explain to you why you experienced that at the hospital, but that doesn't help if you were sick and at the hospital and you feel like, well, why wasn't a nurse coming in right away? It's like, well, we were struggling to staff the unit and to staff the ER. And those, you just feel it on a lot of levels. And for a lot of people, I think the answer is like, I'm just going to get out of healthcare, or I'm going to find something else to do. Perfectly honest, I've considered that at times, like, man, what is this going to be long term? This is hard, this is hard, it's like beyond just coming in and going to work. There's a lot of aspects that are hard, but, for me, it's like, I I can't see myself doing another job. I don't, partly because I don't know how to do anything else, but partly because I don't know, I can't. Like at one point, things were really, really difficult here, both from, just we didn't, we got to a point where there were very few surgeons here in town working at RMC. And it was really, really stressful on me and on the family. And I thought, man, is this what medicine is? Do I need to do something else? And fortunately, that has eased up. But I really, through that, I can't see doing anything different. I don't know what else I would do to have that satisfaction of taking care of people. And I've thought, like different positions or a different setting, but I can't really see leaving healthcare,
Yeah.
Or for me, I can't see leaving surgery right now. I don't know, maybe who knows, down the line I may end up doing something different, but I can't imagine.
That means you're doing what you're
Yeah.
supposed to be doing.
Yeah. So
what would you say to a young person that's thinking about getting into healthcare but is concerned with that side of it?
I was going to say don't do it, but don't put that in the podcast. No, it is going to change. I think that's
It has to, right? Like
yeah. That, and even when it's good, it's going to change. I mean, that's probably the first thing of really any career, any profession is it's going to change. Like, if you want to do this because you want to take care of sick people, you will always have a job. There will always be sick people. And you will always be able to get satisfaction from taking care of sick people. If you want to be like this thing, I was trying to describe it to a student the other day. I said, it's like you go into residency or medical school and you meet doctors and you see these different positions, and it's like having, like a G.I. Joe or an action figure on the shelf, and you try to go in the store and pick out the one that I want to be. Like, I want to be that action figure, but that action figure doesn't exist. Like it does, but there's only one. Your action figure is not going to be like that. So you have to look at what are the things that they are doing, and like, do you like doing that? Do you like working in a hospital? Do you like being around sick people? Do you like solving problems? Do you like talking to people? Because you could be a radiologist or a pathologist and not really interact with patients a lot. Or you could. Some radiologists and pathologists do interact, but it is such a wide open field that you can do almost anything. And it is so big and so wide that your career path is going to go, there's no way, almost no way, I won't say there's no way, but there's almost no way to get through this kind of long pathway and come out the other end and be exactly what you saw. Because by the time you finish it, either the whole system has changed, or that job has changed, or you have changed. Something is going to change. And so you can't go into it to be this picture that you want to be. You have to go into it because you like the underlying principles of taking care of sick people, working in a hospital, solving problems, educating people about their health. Whatever parts of it you like, that's what you have to pursue. And then you'll find the details of how do you do that along the way. I mean, I'm sure like I'm sure you had some experience of that with yours, right? Like
no, mine was all unplanned by accident. Honestly, I had no idea I'd be doing coffee, and
yeah,
I knew I wanted to do business, and I knew I wanted to do like some sort of missions nonprofit work. This ended up being both of them.
Yeah, that's what I mean. You had like these things that you liked,
yeah,
and then you worked to that, and like it'll change. I'm sure like something will change.
It's already, the coffee industry is changing now. The green coffee prices have tripled over the last year, and
wow.
Tariffs now, and it's hard to get cups and lids, and it's changing for sure.
Yeah. And that's the thing that I try to tell people is like you have to be flexible. You have to be willing to change with it, and you have to have some sort of really you have to be tied to some sort of mission that you're like, this is what I want to achieve. I really I didn't understand that. I didn't have that when I got started. I thought like the action figure. I was trying to find who do I want to be, what do I want to be like, and I struggled with that all the way through residency and even to some degree in fellowship of figuring out like what practice do I want? Who do I want to be the most like? Ooh, I like what that person does. I like what that person does. I like that job, but there's not another job like that, and trying to figure out what do I want to do? Because it's kind of set up where you get in at the beginning, and every level that you go through, you have to kind of narrow down to a choice of where do you want to go? What's the next thing you want to do? And I guess that's probably true of life, but it ahead of time in medicine, right? When you get into college, at the end of this, you have to have a major that you complete. And when you get into medical school, from the beginning, at the end of this, you have to pick a specialty that you want to go to. And you got to start somewhere in the middle of the way on that path to getting your specialty picked. And then even when you get in residency, like you've got to figure out what job do you want at the end of this? Do you want to go straight into practice, or do you want to go into a fellowship? And if so, what fellowship do you want to do? And so you feel like you're in this big funnel trying to get to the little spot where it spits you out. But really it's like you're in this, I don't know, you're like a little seed in the ground, and you're just waiting to grow, and then you come up and you kind of grow out into whatever the stuff around you makes you. What's in the soil, what's in the water, what's in the whatever, and you've got what you received from your training and from what's in you, but you kind of make your own interesting thing. I mean, it's like like coffee, right? So you can plant the same seed in 20 different places around the world, and it's going to come out a totally different coffee.
Absolutely.
So that's kind of how medicine is, and even in surgery, like you kind of pick what version of it you want, or what tools. Really, that's probably a better way to think of it. Like you pick what tools you want to kind of arm yourself with, and then you go out and people are going to come to you. You may join somebody who's going to give you a job and say, hey, we want you to do this. Like, we want you to only treat these kind of people, and you're only going to see these problems. Or you may land somewhere like this. Like when I came here, they kind of said, hey, you're a general surgeon. If it's surgical, it's going to come to you, and you figure out if you know how to take care of it, you take care of it. And if you don't, then you find somebody to get them to. And there's, that's a lot to put on somebody who's maybe in high school and thinking, I think I might want to do medicine. But it's really also kind of freeing to know that you have so many avenues, and like just find out, do you like the core principles of it? If you don't really like solving problems, if you don't really like interacting with people so much directly, then you may not like it. Even though you like the idea, some of the other parts of it, you may not like that. But if you do like those things, then you can find a way to make it work. Whatever changes, whatever comes, you can find a way to make that work.
That's really cool. What's in the process for Dr. Jernigan next, do you think?
So the most immediate thing, we're actually getting ready to move. So
Bummer.
Yeah, I think I talked to you a little bit about it. So I took a job actually back very near where I trained. So I did residency in Cincinnati, and I took a job in the northern Kentucky area. So technically it'll be Fort Thomas, Kentucky is the little town we're in,
okay,
or going to be in. And it's a general surgery job. It's in some ways similar to what I'm doing here. A lot of ways very similar to what I'm doing here of general surgery. It's a much bigger place. So, usually the bigger the place, the more narrow your spectrum of things you treat becomes. So, I'm kind of I have sort of mixed feelings about that. I like doing broad-based general surgery. I like seeing a lot of different things and a lot of different types of problems. And I like using, when you're in residency, you learn all these different things. And it's nice to use a lot of those things, say like, oh, that's cool. I still get to do that or see that. But it's also nice to say like, hey, I'm going to like hone in on these few things and try to be really, really good at those things, And then if it's outside of that scope, there's somebody else in the next office over who's really, really good at doing that, So I'm excited about that aspect of being able to kind of focus on fewer things and go deeper, instead of wider. And it's a big group. I know some of the surgeons in the group already, so I'm excited about that. Excited about reconnecting with some people. We've got a lot of friends and connections in that area. So that's the next thing. And there's always, whatever it looks on the surface, it's always to some degree different when you arrive and do it. So some anxiety, some excitement about kind of seeing what is it going to be, what does it become, and sort of grow from there.
Maybe you'll have some time to write those children's books.
Yeah, maybe so.
Well, thank you so much, man. This has blown my mind. It's so interesting to me. Not knowing anything about medicine or the medical field, for me, I can't comprehend it all. But I'll listen back to it a lot.
Yeah.
It'll be fun. Cool. But thank you so much. It's been a pleasure.
Yeah, thank you. It's been fun. And
I appreciate
probably, y'all still ship coffee?
We do. Still ship coffee. We'll get you some.
All right, cool. We'll definitely hit you up.
Thank you. Thank you, sir.